Hi everyone, good afternoon. My name is Dr. Paul Zeitz. Today is Tuesday, March 24th, 2020, and we are here today on a live chat to answer your questions about the COVID-19 pandemic. We are in our second week of a national shutdown, and many people are sheltered at home or reducing social contact or physical contact through physical distancing. And there's a fire hose of information that's pouring out from scientists, from physicians, from the media, as we all try to grapple with understanding the situation. So I am available this week from 3 o'clock p.m. to 4 p.m. Eastern Daylight Time every day this week to answer your questions. And then this live chat will be up on my Facebook page for folks that want to watch it later. So I want to start off, we have received a few questions. I just want to start off with a couple of updates to make sure that you're hearing some of the things that I've identified as sort of key events. First of all, the World Health Organization today reported that the United States is now the epicenter of the global COVID pandemic. That means that the expectation is that the number of cases will be rising in the United States faster here than in any other part of the world. So that's a very alarming kind of reality that we have to face. The other disturbing news is that New York City, the epidemic in the New York City area seems to be accelerating much more rapidly and much faster than expected. Governor Cuomo was on a press conference today reporting that they have 25,000 cases already in New York. The hospitals are already reaching their maximum capacity. And based on the rapid spiking and the larger number of cases, the cases are doubling there every 3 days instead of every 5 days as it's done in other countries. What this probably means is that it's been spreading in the community in New York since January, undetected. So the reason why the caseload is doubling every 3 days is basically the number of people getting tested is going way up, and we're identifying more positive people. But that being said, the new projections in New York City is that they're going to need 140,000 hospital beds within 14 to 21 days when the epidemic in New York City is expected to peak. They currently have 53,000 beds. That's an 87,000 bed shortfall. They are now projecting that they're going to need 40,000 ICU beds. That's intensive care unit beds. And they currently have only 3,000 beds. So they're short 37,000 ICU beds. Their most urgent challenge right now is getting enough respiratory ventilators. Those are machines that are used in an intensive care unit to support people breathing while their body is trying to fight off the coronavirus infection. People are getting a very severe pneumonia and severe respiratory distress, and they require a machine to help them breathe during a critical phase. So I think the governor is calling on the federal government, the president, to rapidly produce and make available thousands. Literally, they're expecting to be 37,000, short on respirators. So that is a pretty serious situation going on in New York. And as the governor Cuomo said, and as Ambassador Birx, the coronavirus task force leader, said at the White House yesterday, we should all heed the wake-up call about what's happening in New York. Earlier this week and last week, we were all looking at northern Italy and thinking, is that really going to happen here? And everyone in Italy was saying, wake up world, get ready, this is coming to you. And now we're seeing a rapid expansion, a high attack rate, rapid uptick in cases in New York City, and there's no reason to expect that that won't happen in other parts or all parts of the United States. I think what we're also seeing right now is that the epidemic is different in different parts of the country. So New York is a situation that now that they've accelerated testing, they're doing a large number of tests there. Now they're seeing that how widespread the epidemic has been and is now, leading to more and more people requiring hospitalization and ICU bed. We don't know yet what the state of the epidemic is in other countries, in other parts of our country yet, but we're seeing it spread throughout the United States. There are hot spots like New York City, Seattle, and New Orleans, for example, are other cities that are already seeing big uptick in cases. Here in Maryland, all the hospitals in the area have started seeing their first coronavirus cases. The testing situation is still very weak here in Maryland. Very few people have access to testing, and so I don't think we really have a full handle of what the state of the challenge will be here. So I want to also give you some good news. The federal government reported today that the testing initiative, which allows people who are showing symptoms, has now really expanded. There is an estimate that that in the United States now, there have been over 300,000 people that have gotten coronavirus testing, and that we're now testing between 50 and 70,000 people per day. So that is a significant improvement in our ability to do COVID-19 testing from where we were even a week ago. We're not where we need to get to yet, and of course we would have liked to have seen this happen earlier, but now that it is happening, I think that is a good sign. And that will allow us to get better at developing our public health strategies and also to prepare our health systems for a surge in cases that may flood the hospital systems. So better data on where the virus is spreading and how fast it's spreading is critically important. So that is, I think, a good news sign. I would also say that more and more states and more geographies, counties, states, cities have implemented more aggressive social distancing rules this week. Here in Maryland, for example, non-essential businesses were closed. More states are expanding and increasing the restrictions on social movement and social distancing. I think we saw in New York City last weekend, Central Park was full and the farmers markets were full, and that is a perfect kind of environment for spreading the virus. And so New York City will even be going to more aggressive, restrictive guidance to accelerate social distancing and encouraging people to stay at home. It's really, really important that we listen to these guidelines and stay home and only go out for essential activities so that we can interrupt the chains of transmission and we can reduce the number of people that are going to be requiring the kind of medical care that happens for a percentage of the people that get infected. So that's sort of my introductory comments. I have gotten a bunch of questions that I'm going to start off with. One of the questions came in from Pennsylvania. Someone asks, and please feel free to put them in the chat there, and I have someone texting them to me, and I can read them from the screen sometimes if I'm paying attention quickly. So one of the big questions the first question that I was asked was, how will we know when and if social distancing is flattening the curve? So the public health measure that is being recommended is shelter in place, reduce physical contact through social distancing of at least 6 feet, and do that every day for the foreseeable future. The reality is that we don't know when exactly we'll be able to know if that works. We did see that Northern California and then the whole state of California were the most aggressive in implementing social distancing in their geographies, where they're living, and the rates of disease so far seem to be somewhat lower. than, for example, what's going on in New York City. We don't know yet, though. As we heard from Governor Cuomo today, New York is expecting its epidemic to peak in 14 to 21 days. So that means, so for this past week, they've already been seeing a big increase in their epidemic, and they're going to be seeing an increase for the next 14 to 21 days, and that will be the peak, they hope, and then it will come down after that, and that will take another several weeks. So I think we have to be realistic and understand that this crisis that we're in, this shelter-in-home situation for many Americans is going to last through April into May and possibly even longer than that. Now I know that the White House and the experts are working on studying the virus, how it's spreading in the United States, and they will be developing public health strategies for every different geography. So what is appropriate for New York may not be appropriate for rural Wyoming, for example. There may be different strategies for different parts of the country. And I think that is the kind of work that's going on behind the scenes right now to understand the data, understand the way the virus is spreading, so that we can develop targeted strategies. But the models that I've seen that have been published in the New York Times by Columbia University are showing if we're successful with control measures like we're implementing in many parts of the country right now, that the curve will be flattening, and if it flattens, it actually also extends the amount of time that people are getting sick and requiring hospitalization. The flattening of the curve is to prevent an overload on the hospital system. So by social distancing, flattening the curve, we're also extending the amount of time that the virus will be transmitted and people will be vulnerable. So it's a balancing act. We're balancing public health with saving lives and with everyone wanting to return back to their normal lives and for getting back our economic activity and the scary things that are going on with our economy. So from my perspective, I'll say I believe that our focus needs to be saving lives. And I know that Ambassador Birx, the coronavirus task force coordinator, working at the White House and working on the interagency agenda, whatever is going on in the public arena that we're seeing in the press, I know her, I trust her, and I know that her commitment is to save as many American lives and as many lives around the world as she possibly can. So she will be using all of her capacities, all of the data and information to help the government develop the best possible responses. And I think right now the worst case scenario predictions are that over 2.3 million Americans could die from the coronavirus, and it could be as low as under 100,000. So I think that's the kind of the reality that we have to choose. So if we choose to stay safe and social distance, we're literally saving hundreds of thousands of American lives and also lives around the world. So I think every life is sacred and every life is valuable. Certainly, I always think about this in terms of if it was my own life or if it was a life of someone in my family or one of my loved ones or my friends, I would value that life as equal. So all these lives out there that are at risk right now, I think this is an opportunity for Americans to come together, to join forces in solidarity to save as many lives as possible. So I think that's the first question. The next question that came in from Southern Florida, and this question is focused on data coming out of Italy on how the elderly are acquiring this and what was going on in northern Italy that made the situation so difficult and dangerous right there. I mean, I think right now we have more data coming out of China and South Korea right now. Those epidemics have declined dramatically. We know in those countries they did aggressive public health measures. They did abrupt, aggressive, restrictive social distancing. They also implemented a strategy where mild cases were not returned to their families. They were isolated in dormitories or in hotels or in places where they were isolated. They were not returned to families. And that is a recommendation that I've been working on behind the scenes. And also, I just posted a blog on my website, Dr. Paul Zeitz, calling for states and counties to isolate mild cases from their families so they're not transmitting it within the family system, as was done in China and South Korea. So in Italy, the area that was affected most dramatically was an area where the health system is pretty good. However, it's an elderly population, and the virus was spreading for a while before the Italian government implemented public health control measures. So by the time they started shutting down northern Italy, and then they shut down the whole country, they had already had widespread community transmission in a largely elderly population. So that live in close quarters, and it spread through droplets, and it could have been a number of healthcare workers have also been affected and have died or gotten sick. So people that were caring for these elderly people. The other thing that we've seen from Italy is that young people are getting very severe illness. They don't die as frequently. The case fatality rate is much lower. But people that are younger are also getting severe illness. Most of the fatality rate is still people in the elderly age group or in the age group or people that are immunocompromised. So I think there's a lot more to be learned about what's happening in Italy. Unfortunately, we're now seeing a big upswing in cases in France, Italy, Spain, and the United Kingdom. The United Kingdom has gone very aggressive now in shutdown mode. India also closed down all domestic airlines. They closed down all businesses as of today. So they're at an early stage. They're trying to implement the most effective strategy like South Korea and China did, which was to aggressively implement social distancing with restrictive and halting interruption of human-to-human interaction. And that has been proven now in Singapore, South Korea, China to be the most effective way to control the virus. So, great. I'm going to take a breath and have some water and read the next question here. Yes, Rahim, go ahead and ask your question, even though you're not living in the United States. I'm happy for you to answer your question. If you can pass that forward. So please, if you do have questions, feel free to message me through Facebook, or as some people are doing right now, or you can do it on the Facebook chat right there. I also, wanted to talk about some of the questions that came up yesterday that I thought were really important. One of the questions yesterday was a woman who is herself vulnerable because she has chronic medical conditions, and her mother is in a nursing home, and she's not able to get information or to communicate with her mother frequently about what's going on there. And of course, as you may know, many elderly facilities around the country have been shut down to visitors. People living in those facilities are being no longer having community meals. They're being brought their food to their room. So psychologically, that's very challenging. And of course, they're disconnected from their loved ones at a time when everyone needs support. So that was a really tough situation to navigate. And my advice was to, first of all, be persistent in trying to reach your loved one. Find a way through the nursing station or through the administration of the facility to schedule a call with your loved one if they don't have a phone by their bedside. And also do whatever you can to reassure them that even if you're not in communication with them, that you're connecting with them, that you're there with them in spirit, and that you're there to support them, so that people aren't left with a sense that they're alone. And I think we have to find innovative ways to express this kind of solidarity with people that are isolated in elderly facilities. I think that the situation around this action that elderly facilities are taking is extremely warranted. I read a report yesterday that there are 73 elderly facilities in 22 states around the country that have COVID cases right now. So if you remember what happened in Seattle, that first outbreak of the virus that was identified was in an elderly facility where dozens of people died. So this is another alarm bell that we should be heeding, and taking our time and getting comfortable with sheltering at home, and recognizing that the more that we do that, the more likely we are to reduce the transmission of the virus and to reduce the death rates among those who are most vulnerable. So I think I've answered that question. Raheem, I don't know if you're on the line, but your question has not come through. There's a question on the screen there, which I cannot see. Someone, let me just see if I can read this, sorry. If you could, okay. What drugs should we have in the house in case someone does get COVID-19? Questions about what to take or not to take, Tylenol, etc. Aleve or Motrin. Many conflicting posts about this. Okay, yeah. Yeah, so what's happening is that as countries around the world are responding to the pandemic, there are different kind of bits of information that are coming out and that are being recommended. And then the question becomes, how do we respond to that information? So in my current state of recommendations on this, I will give you my update. And I've been, of course, consulting with my wife, Dr. Mindy Cohen, who is a primary care doctor here in Maryland, and also other experts. So first of all, from a preventive perspective, I think it's really important for everyone to stay calm, practice staying calm, not being in a state of panic around this, because your emotional health affects your physical health. So this is a good time to take those long walks, plant a garden as spring emerges, do meditation or yoga or other practices that may be helpful to you. And then we are recommending that you consider taking vitamin C and vitamin D3 as immune boosters, 1,000 milligrams of vitamin C and 5,000 units of vitamin D3. Can't hurt. Why not take that? There's been some reports that we should be taking, that we should avoid non-steroidal anti-inflammatory drugs, that there might be some interaction between those drugs and the severity of the illness. According to the WHO and the World Health Organization and CDC, there's no evidence to confirm that concern yet. It is being studied, and so I think that's a question mark. So in that situation, I would say if you can avoid non-steroidal anti-inflammatories and you can take Tylenol or paracetamol or acetaminophen, which are a different class of drugs, to deal with a headache or a fever, and that works for you, then you might want to consider that, or consult your doctor and feel free to ask them questions about it. I think there's no problem reaching out to providers for these kinds of questions. The other question that's going on is around folks like myself that are on ACE inhibitors. It's a class of drugs that's used for high blood pressure, angiotensin I forget what the word stands for exactly, the acronym, but ACE inhibitors. And they are, there's some evidence, or some reports anyway, coming out of Italy in particular, that ACE inhibitors may be a factor on why many people in Italy, northern Italy, got such severe illness. Again, there's no confirmed study of that yet, but the literature and scientists and medical experts are studying that aggressively. I just want to take a pause right now and invite you to, as part of our response, as you all know, I'm a political activist, and I believe that we need to hold our government accountable for doing the right thing. We can't leave it to them. We have to demand and call on them to take the right action. So Build a Movement 2020 is the effort that I'm part of now, which is a movement of people from all political parties, from alliances, coalitions, organizations, and individuals. We have thousands of people that are participating in Build a Movement activities. And we launched this week a couple actions that you can take. One is to tweet to President Trump. We know he likes Twitter. If you text Ban 2020 Trump to 52886, there's a system in place where you can get your tweet directly to President Trump. And we also think it's really important for all Americans to take a few minutes to call on Congress, your members of Congress, your governors, your mayors, and call on them to take bold action. There's concern about the economy, but while that is a real concern, we also have to focus on saving as many lives as possible. So we have another action that you can plug in your zip code, and then your message goes right to your members of Congress, right to your governor, and right to mayors in your area. Please text BAN 2020 COVID-19 to 52886 to be able to take that kind of action. I think that's hard to see maybe. You can also go to www.ban2020.world to get all this information. Okay, I'm going to go to the next question here, which is coming from Rahim. He says, the question I want to know, if the strength of coronavirus depends on weather conditions. I ask that question because I assume most of the countries affected by COVID-19 have cold weather conditions like Europe and the US. But in Africa and most countries, in North Africa, Egypt, Morocco, Tunisia, and South Africa, are the least number of infected. This is they have warmer conditions and so forth. Is this assumption true or false? Thanks, Rahim. That's a really good question. I'm getting asked that quite a bit, and I've been studying up on that. And we do know that some viruses have seasonal variation. We do know, for example, the influenza virus, the flu virus, does have a cyclical pattern depending on the season of the year, where it increases during the winter months and it decreases during the hot months. And that was also true for some of the coronaviruses that have circulated in the past. Now, it's too early to say yet what this particular strain of coronavirus, the COVID-19 version of coronavirus, how it will operate. And that is something that is being studied very aggressively right now. There are factors like temperature, but there's also humidity, which might be another factor. So if you have higher humidity, we don't know yet, but it's possible that humidity could be, there's more moisture in the air, and so the droplets could be, the virus may attach to water droplets in the air. It could be more transmittable in that way. It's too early to say. The other factors that are, that we have to be cautious at this point on is, I don't know exactly how many people are being tested in all those countries that you're asking about. So I think, I do know, for example, in Tanzania, they were rapid in taking up the WHO recommended rapid test, and they were doing testing pretty quickly. I don't know if they've been able to make that testing available across the whole country of Tanzania. And so we may not be seeing the actual spread of the virus in some of those kind of places. We also have to look at the population structure of a country like Tanzania, where most of the people are very young, and there's much less people. So it's like a pyramid population where the bulk of the people are 0 to 24, and there's fewer people that get older there. And so we do know from other countries that this virus doesn't cause a serious illness in most younger people. So that could be also part of what's going on. There might be a lot of people that are infected with either asymptomatic or mild cases of COVID. It's too early to say. In places like Egypt and Morocco, I mean, I am concerned. I did see Egypt numbers starting to tick up. And I do know that Iran has a very serious outbreak. And so because of the migration patterns and the mobility patterns in that area, we know that there's high risk in that zone as well. So I think the more aggressive actions that those countries can take, the better off that people in those places will be. So I hope that answered your question on that. So I am wondering if there are any more questions. We've been going for about a half hour right now, and please feel free to add on your questions now through the chat or through, I think I did get another one. Let me just pull that up. Oh yeah, here's some more here. Okay. Okay, so some of the questions that I just wanted to go over with folks today is there are a lot of unanswered questions out there that people are trying to figure out. So another big question, we've covered a couple of these things, which is it might be seasonal, but we don't know yet. It's being studied. We are wanting to, a lot of people are asking, what should we do if we have symptoms? And how do we handle it at home? So I think the most important thing that you need to be looking for is fever. So some households are starting to do fever checks at least once or twice a day to see if you have a fever. And people that have fevers should be isolated in the household, meaning they should be put into their own space, their own room, if you have enough space, and they should be provided their food into that room. They should stay in that room. They should not be interacting with other people until their fever has been gone for at least 24 hours. If they're showing signs of higher fevers, or they're showing other symptoms like cough or muscle aches or other aspects of a viral illness, then there is, then I would recommend that you call your physician and determine whether or not COVID testing is available. There is still strep circulating, so sometimes physicians are recommending a strep test, or they're checking for influenza, although that is starting to wane right now. And then there is COVID testing also as a possibility. So I think the most important thing is to also think through if you have people that are elderly, or you have people that have chronic illnesses or are immunocompromised, or for pregnant women, that you think about a plan and different scenarios about what you would do if, God forbid, someone in your network actually did get sick. So thinking about what hospital you might go to, or who would care for children if an adult got sick, thinking through the different scenarios so that if someone gets sick, you're prepared and you can handle it and think it through in advance rather than doing it while you're in a crisis mode. I think that's prudent to start doing. My family has certainly figured out where are all the pods where people are sheltering in place. How are they managing people that may have been exposed or had symptoms? And then once everyone in a pod reaches the 14-day clearance, how do they maintain the pod as being COVID negative? And then if someone does become positive, how do you respond in terms of isolating them? And then how do you respond if people need to get medical care? So I do think it's worthwhile to think through all these different scenarios. Okay, I think there's... Okay, no, I don't have any more questions, so I just wanted to... I do want to just end with a small discussion about what's going on at the political level, because I think it's a really important opportunity for us as Americans to understand the dynamic that's going on. You have a situation where our values have to be discerned, and our values have to be guiding the political decisions that are made by our political leaders. And so right now, we have a novel virus that's creating a pandemic in our country. We're the epicenter of the pandemic globally right now. We have hotspots that are exploding with transmission and people requiring hospitalization. And our hospital system is not prepared at this point to absorb the expected demand. And so there's actually a choice that our government and we as Americans have to make about what choice do we make? Do we value saving lives, or do we value other priorities? And so I am a strong supporter of Tony Fauci. I know him, I've worked with him, I respect his judgment. He's a global expert on infectious disease epidemiology and management of epidemics. I trust and support Ambassador Deborah Birx, who's the White House Coronavirus Task Force coordinator. And I think it's very important for all of us to get behind a data and evidence-based response, and a data and evidence-based decision-making about what needs to happen right now, both from a public health perspective with these restrictive measures that are being recommended, as well as the therapeutics and the clinical management of the pandemic. I don't think we need uneducated political leaders determining what the best medical regimens are. I think we need physicians and medical experts to make those decisions. So I think it's time to call your member of Congress, call your governor, call your mayors, and demand a data and evidence-based response to protect the people, test the people, and treat all the people that are going to be needing support and action as we respond to the COVID pandemic. So any last question? Again, I want to remind you to take action by going to texting BAM 2020 Trump to 52886, or calling on Congress by texting BAM 2020 COVID-19 to 52886. These are opportunities to take action. If you do take action, please spread the word on your social media so people in your network can join us in this movement to hold our government accountable for the bold and healing action that's so urgently needed right now. So thank you so much for joining this live chat today. It's been interesting and fun to connect with you and support everyone as we're navigating this very kind of challenging pandemic. I'll be back tomorrow, Wednesday at 3 p.m. Eastern, Thursday and Friday as well. And to answer your questions, please feel free to chat them to me through Facebook or through my website, and I will be compiling a set of questions and responding to them tomorrow. Thanks everyone, and have a really great day. Stay safe, stay healthy, stay calm, be patient, and remember that as much as we are sheltering in place, we are also in solidarity with saving as many lives as possible at this critical juncture in our history. Have a great day. Peace. Bye.